Hello again, ladies and gentlemen. The topic is jugular venous pressure, aka jugular venous pulse. This is a direct measurement of the pressure in the right atrium. Why? Because there are no valves between the right atrium and the internal jugular vein. Where is the jugular vein, or the internal jugular vein? Where is this pulsation? Where do we find it? How do we locate it? How do we observe it? So at this point, what we should do is the patient should be undressed with the removal of their upper garment, and we will position the patient in a semi-recumbent position between 30 and 45 degrees. We will examine from the right hand side and therefore ask the patient to look over their left. In doing so, we engage the sternocleidomastoid. This muscle, when you look over the shoulder, becomes visible. Remember, the SCM, the sternocleidomastoid, the action is to primary action is for contralateral rotation of the neck. The inferior border here will be the clavicle, and you have the fossa here, the supraclavicular fossa. It is in here where the JVP, the pulsation, will be visible. So you can actually locate and actually see this pulsation. If it's difficult, you can use a torch, and this will help you better discern the pulsation. Where should the pulsation be? The pulsation should be 2 to 4 centimeters above the angle of Louis. L-O-U-I-S, that's the angle of Louis. Also known as the Manubrium-sternal angle. Just to remind ourselves, we have the sternum. At the top, we have the Manubrium. At the bottom, we have the xiphoid process. Remember when you do CPR and we do chest compressions, they ask us to clear the 2 fingers here. It is the xiphoid process that we are clearing. So the Manubrium sits here. When you look at it side on, it has its own angulation as compared to the sternum. So if you were to put a cue stick over here and let it run over, then a cue stick over here and let it run downwards, the point of intersection between these cue sticks is the angle of Louis, the Manubrium-sternal angle. It should be 2 to 4 centimeters above this. If it is any higher, that is what we call a raised JVP. And what is that indicative of? This is indicative of right-sided heart failure, constricted pericarditis. You could have superior vena cava obstruction, could be cardiac tamponade, and finally it could be hepatomegaly, i.e. an enlarged liver. So because it could be an enlarged liver, we will also do something called a hepatojugular test, hepatojugular reflux, abdominal jugular test also. It's all interchangeable terms. So what do we do here? Remember, the liver resides it's anatomically located in the right upper quadrant. If you want the precise location of the liver, you can have a look at the liver video on the anatomy of the liver. Deep palpation here will cause obstruction of the portal vein. That in turn empties into the inferior vena cava, into the vena cava and the right atrium. Now if you cause obstruction here, that means the pressure in the right atrium will increase, because pressure and volume are inversely proportional. When one goes up, the other goes down. So as we compress, the volume goes down, the pressure goes up. And so because the pressure in the right atrium ultimately from the portal vein has raised, that will manifest itself over here, and you will see the JVP raise. I hope that helps. Thank you.